you know Neolth, you know that our company is really co-developed in partnership with young people. I believe we have 400 right now who have come through the company in just the past 2 years. So it's just been incredible being able to work with these kids at the high school and college level. I'm Dr. Katherine Grill. I am the CEO and co-founder of Neolth, and at Neolth we provide stress and mental health support to teens through a self-guided mobile app. So I always say that Neolth was the result of just my entire life. Growing up, I came from a more low-income family. We didn't have access to mental health care, and I could just see how devastating that was. I had family members with serious mental illness and became interested in mental health care. I originally went to school to become a therapist and worked in patient care for a bit, and gosh, just loved working with folks on mental health and working in psychiatric care, but was really frustrated by the inequities in the system. It was very much so, if you can afford it, you're getting access to care, and if not, you didn't have the health care, which I believe is a basic human right. So I went on to get my doctorate in neuroscience. I did what's called NIH research, so large clinical research studies for teen mental health, and really learned how to build and validate health programs. And ultimately that led me to the tech space because I wanted to build those programs and then launch them at scale. To say that the kids are what get me out of bed every morning. If you know Neolth, you know that our company is really co-developed in partnership with young people. I believe we have 400 right now who have come through the company in just the past 2 years. So it's just been incredible being able to work with these kids at the high school and college level because they're messaging me every day on Slack and telling me, Dr. Grill, I was able to talk to my friend and share about mental health with them and get them access to care. There's one student in particular that I really think of who has actually a student story on our app that people can go and listen to, but she talks about how she was feeling really depressed and feeling suicidal when she was in high school, and mental health in her family was very stigmatized. She wasn't able to get access to a therapist, and what it took was actually her cousin dying by suicide for her family to realize that, hey, I think that we should really start to look into mental health care and mental health services. And she says programs like Neolth are really for kids like her who were struggling, who didn't have access to care, and they can get that on-demand support. So hearing those stories is definitely something that gets me up every day because I know that's the mission of our company, and we're really having the impact that we set out to have. Joined StartUpHealth in 2018. We were just myself, my co-founder, and an idea, and it was so awesome to become part of StartUpHealth because they were really the only folks who were saying, hey, it's a great idea, we'll take you on even though it's really early. And since then we've built up the product, we've built up our research, and now we're really on to the commercialization phase. So one thing that's really exciting for Neolth is that we just launched into the APAC region through a partnership with a company called Mango Steams. So our program is going to be launched in 20 different countries internationally in the schools there in Asia. And another thing, actually this month in November, we're launching with a financial services company who's going to be including Neolth as a member benefit for all of their students. So really looking at some of the more nuanced partnerships that we can have and finding that financial stress is huge for young people, and the intersection of finance and mental health is this new avenue that we can get into. So we're excited to launch that partnership actually just starting in a couple days. So my background, I was a scientist, I used to do NIH research, and evidence base is really important to me and to the company. So as we've been building up the company, we've been doing our own internal research, and this past year we've been able to partner with external partners. So one of them is the University of Iowa, the Scanlon Center for School Mental Health. We're really excited to work with them, rolling out in schools across the Midwest. They actually started earlier this year with an intervention for teacher well-being, which I think is so important following the pandemic because there are high levels of burnout. And they're now working on a randomized controlled trial integrating Neolth into the health curriculum, looking to integrate into the schools throughout Iowa. So that's really exciting for us to start to integrate into the DOE curriculum. We're also working with the University of Miami, Dr. Azizi Seixas down there. They have a fantastic program where they're working in schools both in Miami and some more rural areas in Florida, trying to increase access to care for students with a focus on students of color. So we're very excited that we just launched a 7,000 student research study with them, and it's the largest research study that I know about looking at digital mental health in the schools. So it's an exciting year for us, and we have some more research partnerships in the pipeline that we'll be able to announce in 2023.